Welcome to our YouTube channel, Safety Guidelines. I'm partner of Fahim Azam. The topic for this video is very interesting and informative for the winter season. Please do watch it thoroughly until the end to get benefits of this video. Preventing kids from cold and flu. An overview of this topic. When temperatures start turning colder and kids are inside and interacting with each other, cold and flu season inevitably follows. You may know that cold and flu season is around the corner, but that doesn't make it easier when you see your little one struggling with cough and a stuffy nose. Children under the age of 5 and particularly under the age of 2 are at an especially high risk during this season. There are steps you can take to help your child feel better while their immune system battles the flu. Offer them plenty of fluids. Keep your child hydrated to help reduce cold and flu symptoms and to make them feel better. Fevers can result in dehydration. Your child may not feel as thirsty as they normally would, and they may be uncomfortable when drinking, so it's important to encourage them to drink plenty of fluids. Dehydration can be very serious in babies, especially if they're under 3 months old. Call your pediatrician if you suspect your baby is dehydrated. Some signs may include no tears when crying, dry lips, soft spots that seem sunken in, decreased activity, urinating less than 3 to 4 times in 24 hours. Ask your little one's doctor if an oral rehydration solution is appropriate. Remember, you shouldn't give little ones energy drinks. Older children have more hydration options, which include energy drinks, popsicles, juice, broth, and flat white soda. Clear up stuffed nasal passages. Medicated nasal sprays aren't recommended for young children. Unfortunately, there are several easy ways to clear up a stuffy nose without medication. Use a cool mist humidifier in your child's room. This will help break up mucus. Be sure to carefully clean the humidifier between its uses to keep mold from developing in the machine. Another option is using a saline nasal spray or drops, which makes thin mucus easier to blow out or remove with a bulb syringe. This is especially helpful before feeding and bedtime. Loosen the cough. If your child is over 1 year old, try giving honey for a cough instead of medication. You can give 2 to 5 ml of honey a few times during the day. Studies show that honey is safer and likely more effective than cough medicines, antitussives, for children over 1 year old. You shouldn't give honey to children younger than a year old due to the risk of botulism. Promote rest. Extra rest can help your children recover quickly. Your child may be very hot due to fever. Dress them comfortably and avoid heavy blankets or excessive layers that could make them feel hotter. A lukewarm bath can also help them cool off and wind down before taking a nap or going to sleep for the night. Know what to give and when. Adults can easily take cold and cough medications, but the pediatricians recommend it against children under the age of 2 for taking over-the-counter cold and cough medications. If your child has a fever or symptoms of cold and is under the age of 2, call your pediatrician to determine first if you need to give any medication and how much you need to administer. Remember that a fever is the body's way of fighting off an infection. When your child has a low-grade fever, this doesn't always need to be controlled with OTC medications. See your child's doctor. Sometimes even the best at-home care isn't enough to help your little one make a full recovery. Call your doctor right away if your child has a fever greater than 101 Fahrenheit, which means 38 degrees, for more than 2 days, or a fever of 104 Fahrenheit, which means 40 degrees or higher. You can call the doctor if your child has a fever of 100.4 Fahrenheit, which means 38 degrees or higher, and is under 3 months old. You can also take recommendations from a doctor if your child has a fever that doesn't get better even after taking acetaminophen or ibuprofen, or if your child seems unusually drowsy or lethargic, or won't eat or drink, or is wheezing, or is suffering from shortness of breath. You should always call your child's pediatrician if you have any concerns or questions about their health. How to protect others. If your child have a cold, you should follow these tips to help prevent spreading it to other people. Keep children out of school or daycare while they are sick. Avoid close contact with others, such as hugging or shaking hands. Move away from people before coughing or sneezing. Cough and sneeze into a tissue, then throw it away, or cough and sneeze into your upper shirt sleeve, completely covering your mouth and nose. Wash your hands after coughing, sneezing, or blowing your nose. Disinfect frequently touched surfaces and objects such as toys, doorknobs, and mobile devices. Note that there is a vaccine to protect you against the common cold. Surviving the cold and flu season. After your child recovers from a cold or flu, it's time to go into a prevention mode. Wash all surfaces they came into contact with before or during their sickness. Encourage your children and your other family members to wash their hands regularly to keep future germs at bay. Teach your child not to share food, drinks, or utensils when they eat to avoid spreading germs between them and their friends. The cold and flu season does come and go. It shows your child some steps to put them on the mend can help you make it through cold and flu season. Thank you for watching our video. Do remember to subscribe our channel. Press the bell icon to receive notifications regarding our further informative video clips. Like, comment, and share our videos to encourage me and our team. Have a good time. See you in the next clip. Till then, goodbye.